Hello and welcome, it's Chris from Christopher Hall Training. Welcome to this tutorial where I'm going to be talking about a lady that I worked with who had injured her back, and just going to talk a little bit about some of the bits and pieces that we did together to rehabilitate her back to fitness. Now her sort of explanation of it is below. If you're on the blog or if you're on YouTube, it'll be in the description. So you can read about her experiences of it. But in the meantime, I will sort of explain what went along with that and the type of things that we were doing. So her original back problem was in 2008. This is the very, very first time that it happened. This was before she came to see me. So that was the original injury. But then when she came to see me, she had been lifting a cooker into the back of a car, and she'd bent down to sort of, it was leant on the sort of the boot, she'd leant right down to sort of push it up into the back of the car, and she felt a ripping sensation in her back. She was then sort of in agony, bedbound. Eventually she got to see a chiropractor who did the initial rehabilitation. Now, that is a point where I can come in, but in this example, or in this case study, she went to see a chiropractor first, and then in talking with a friend of hers, he mentioned my name and to go and see me because he knew I had some expertise in lower back pain and helping people get back, sort of rehabilitating their lower back pain to wherever they want to get. And her sort of goal was to get back to the fitness where she was before. So she wanted to, or she used to do classes, she'd run regularly, she was sort of, you know, keeping fit sort of 4 or 5 days a week, so she wanted to get back to that. Obviously, as I mentioned, she'd been bedbound, she'd seen a chiropractor for a few months, and then she had moved on to me. So that's one way that I can work. If you've been to see a physio, if you've been to see a chiropractor or any sort of health professional to help overcome lower back pain, I can then pick you up once you've sort of got out of pain and you're back moving again, and then I can take that on to sort of further rehabilitate using sort of exercising, stretching, so on and so forth. So we got together. So we start, as I always start with someone, with questionnaire consultation. So I just get them to fill out a questionnaire before I sort of meet them, see them, just to get a bit of a background and a bit of understanding of their injury, how it occurred, so on and so forth. Then we meet up and we have a consultation over the phone, or it can be done face to face. It could be done over Skype, depending on where the person is. So we go through that. I then delve a little bit deeper. Once I have a read of that questionnaire, it sort of gives me an insight into their injury, and then I can start looking at, well, I need to investigate in this direction, or I need to find out more about this, or I need to find out more about that. So I kind of create a bespoke consultation. So when we meet up for that, be it face to face or online, yes, there are some general questions that I need to ask and that I will ask, but there are also some specific avenues which I want to delve a little bit deeper into. So I go into that and we go through that, and one of the sort of the bigger things, now she was back up and moving. Before she got or wanted to get back into exercise, she was very nervous about exercise. So it was very much where her back had gone through some degree of healing, there was still in her mind some things holding her back. So where it wasn't necessarily a physical block, where there may well have been some physical blocks, and obviously we'll find out more about those, there was some definite mental blocks as to going back into exercise, going back into sort of an exercise class environment or a running environment or whatever it might be. So that was a big part of what I needed to help her through. And so once we'd completed the questionnaire and consultation, it's then a physical assessment. So assessing the lower back pain, although she would have gone through a degree of that, and I would have understand some of that from the questionnaire, the initial questionnaire and consultation, I still take people through a physical assessment, again, just to build a functional understanding of their lower back pain, because some of the things they could be saying could then be represented in how they move, or it could just be sort of in their head, and then how they move, it's not represented in their sort of their physical body. So that tells me a story as well. So once they go through the physical assessment, now again, if you're working with me online, I've got those sort of assessments and tests online in video form. I'm talking you through how to do it and what you need to note down, and then obviously feed back to me. So I can then get all of that information if I'm working with someone online. But yes, we were face to face, and then it was a case of me taking all that information and then trying to build a starting exercise program. Now, what I always explain to people is this program is going to mold and change as you go through it. You'll give me feedback as to this is working, this is not working. I don't feel confident doing this, but I feel more confident doing that. So I've then got to update the program and sort of mold and change it as it goes. So once we've got to the program, it's then we start. So it's very much what we were looking to do is build up her core strength and stability. So we were just using very simple exercises, planks, side planks, bridges, bird dogs, just to build that initial sort of core strength, core stability, core endurance, and confidence in using her core muscles. So a big part of what I'm doing is not only a physical training, it's a coordination and mental training. So I've got to connect to make sure that she can brace her abdominals whenever she needs it. So she's not just going into a plank or a side plank or any of these exercises and just holding the posture. I'm making sure and asking her the question, have you braced your abdominals? And then I can go in and physically test that she's doing it. So I know that she knows what that feels like. So whenever she goes into any sort of movement, she can then engage those muscles when required. Now, the big thing she was apprehensive about was lifting anything off the floor, because that was the posture she was in when her back went. Now, she hadn't shown any signs of her back becoming a problem again. So all the exercise, I'm gaining feedback. Okay, how's that feeling? Yep, back's feeling good. Okay, good. We'll continue. We'll progress it, so on and so forth. Then I come to the point where I want to now get her lifting exercises, building up some whole body strength, which isn't necessarily sort of directly related to the back problem, but there was a general fitness part to it as well. But if we stick to the parts that were for her back, a big part of it was lifting off the floor. So it was taking her through, making sure that she could use the hip hinge effectively. So it's using the hip hinge, so hinging from the hip. So imagine legs here, or legs here, upper body here. So she's hinging at the hips, bringing the torso forward, taking the hips backwards, and obviously the legs were on the floor. But with that, using that abdominal brace that we talked about. So again, I'm not just throwing her in and saying, right, lift this off the floor and use the abdominal brace. I've trained the abdominal brace. I've made sure she can brace the abdominal. She can feel it working. She knows how to take pressure off the back. So when we come then into the hip hinge, where she's now got to think about the movement as well as the bracing, this is another time where she's now upskilling herself and giving her greater sort of movement competency when it comes to overcoming lower back pain. So we would go about, again, we would start light, we would lift and raise the weight off the floor. So again, she wasn't lifting from the floor to start with, it's training the hip hinge, building confidence in that hip hinge, building confidence with the abdominal brace, and then teaching her how to keep the weight close and lift off the floor. What would then happen, the weight would get lower to the floor, the weight would get slightly bigger and slightly heavier as she's gaining confidence. So physically, I know she can do it because all the way through, her body hadn't given me any signals to say, this is going to be a problem. So we're training all the way down towards the floor, but also increasing the weight, gaining confidence in knowing how to not only brace the abdominals, but brace the whole torso using the shoulders back and down and engaging the lats as well as another sort of protective mechanism. Another key thing is engaging the gluteal muscles, so the glute muscles, the buttock muscles. Using the shoulder bridge is a very effective way of doing that. So making sure she knows how to engage the glutes. So again, when she lifts, she can then do that. So all of this sort of movement exercises that we're doing later on in the course, I prepped for all of that before the scenario of actually lifting the weight. So it's making sure that she knew how to lift that weight correctly with the correct technique and using the correct muscles. Because I've mentioned before that when I work with some people, they find it very difficult to coordinate their body and move it, as well as thinking about all the joints that are moving and the muscles that are working as well. But what I'd done previously with the plank, the side plank, the bridge and the bird dog is I prepped all of that. I was aware that that was possibly going to be the case, so I prepped all of that early on. But in the meantime, I was building core strength and stability as well as. So I built all of that, and then we'd gone into the lifting. So we'd sort of overcome that nervousness and that anxiety about lifting from the floor. The main thing was her running, was sort of changing the technique of her running. So she was a big heel striker. Now, when you heel strike, that's sending a lot of shock up through the legs and into the lower back. Now, if her lower back's vulnerable, if she's pounding a pavement and whacking her heel into the pavement, that's going to be sending shock a couple of times a second for an hour, all the way up into the lower back, going to leave her vulnerable. But if we move her forward on the foot and bring her more sort of mid-foot onto the ball of the foot, what happens is that load gets distributed throughout the limbs. So the calf can take a lot, the Achilles tendon manages, and you run on that spring, which is the Achilles tendon. But again, it wasn't just throwing her in and saying, right, go and run on your toes, because the calves won't cope with it. That will create its own problem. The feet won't cope with it. Again, that will create its own problem. So again, it's coaching that. So it was up on a treadmill. Okay, let's just do 30 seconds at a time, 1 minute at a time, just running up on the toes. How does that feel? Get a slightly faster cadence, so slightly faster foot movement or leg movement, rather than big, long, sort of ranging strides that she would normally do. So it's understanding that. And then what would happen is once we got her back to a certain point on the treadmill, it was then saying, right, okay, let's go and try this out on the road. Let's go and try this on the pavement. If you can get onto grass, great, because it's a slightly softer surface, and that's going to help as well. So again, it's preparing. Now, what's the right time to start running or to start putting that much impact through a bad back? Well, there is no real time. The coach, myself, and the person has to use their judgment. So I'm asking them what they're confident with doing, because that's going to be a central part of her progress. Obviously, I know there's going to be a certain degree of impact, so it's very much I'm suggesting, well, we've got to try it. There has got to be some point at which we try this. So I'm going to err on the side of caution and just say, right, we'll just go out for a 20-minute run and just at the start do a minute's worth and then go back to your normal running. And then after 10 minutes, do another minute's worth, go back to your normal running, and then finish. Give it a couple of days, see how it feels, gain some feedback from your body. How's the back feeling? How are the legs feeling? Okay, well, they're feeling okay. Right then, well, let's stick with 20 minutes and let's go to 2 minutes at a time and build up from there. So again, it's a very logical process in the sense that what we're trying to do is not only build her back physically, but build a confidence back sort of in here mentally. So the whole time of me coaching, it's not just saying, right, here's a bunch of exercises, go and do them, go and complete them. I've got other examples of this where I'm going to be doing more videos and tutorials like this where I've got a case study and I'm going to explain the process that I went through to be able to get to that point. What we were then able to do is get her back running. We got her back doing her classes. Again, that was a whole nother process. Right, go into the class, make sure you're doing the exercises that you're confident with. If there's any movements that you're not confident with, don't do them. So again, every aspect we're sort of taking a very cautious approach to getting back into it. Making sure, I'm not saying, right, you need to go and do 20 minutes of this. I'm suggesting, right, there's 20 minutes, let's start there, but you've got to see how you feel. If you think 10 minutes is enough, then you do 10 minutes. If you think 50 minutes is enough, do 15. If you think 20, if you can do that, then go and do it. So it's very much a dialogue between me and the client, making sure and gaining feedback from them about what they're confident about, how their body is feeling and how their body is responding, not only immediately in the gym environment, but also in the preceding days afterwards. So when I'm working with people, that's how I work. It's not a program that I've designed and go, right, finish that, go and complete that and come back and see me in 6 weeks' time. It's very much an ongoing process of, right, we need to start here because we've collected information. This seems like the best thing to do based on the information I've been given. So we start them doing it, and then we mold and refine it as we go through. And then as we go through, we select each of the goals that we need, and then we build them into the program. So that, in a sense, is how I worked with Jacky, and that is, in a sense, the broad outline of how I work with everyone with regards to initial questionnaire, consultation, physical assessment, writing of program, and then the administering of that program, gaining the feedback all along the way. So many thanks for listening. Hopefully it's given you an insight into how I work with people. Hopefully it's also given you an insight into how you could potentially overcome your lower back pain. If you want to self-coach it, I've gone through a lot of sort of tips, tricks and things that I use to be able to get me there. Obviously, if you want to work with me, then fine, great, get in contact. Email me at chris@christopherhalltraining.com. Then, we can sort something out. I'll possibly put some links at the bottom of the page where you can find some sort of online products and services. Or if you're in the Bristol and Bath area, then please do sort of come down and see me and we can go from there. Or even like a blended, if you're a bit further afield, but you want to come and see me once a month, and then in between we're emailing and Skyping or whatever, then that's possible as well. Anything is kind of possible in this day and age with the technology that we have. So many thanks for watching. Hopefully it's been helpful. Hopefully you've gained a little bit of an insight, not only into how I work, but also lower back pain. So many thanks for watching. My name is Chris. I'll speak to you in a future tutorial.